So welcome back to chapter 11 on pregnancy and infancy. So we were talking about exercise. So what we do know that there's more to pregnancy and exercise than just skipping it entirely. So recommendations are, unless you're experiencing serious complications, sitting around is not what's recommended. In fact, pregnancy can be a great time to get active, even if you haven't exercised in a while. So we know that during pregnancy, exercise can help prevent some of the back pain and other discomforts, boost a woman's mood and energy levels, help a woman sleep better, help prevent excess weight gain, and increase a woman's stamina and muscle strength. Exercise during pregnancy might also reduce the risk of gestational diabetes, pregnancy-related high blood pressure, as well as help lessen some of the symptoms of postpartum depression. It's also known that it might reduce the risk that the baby's born significantly larger than average, so that greater for gestational weight baby. We know that before entering exercise program, women need to have a healthcare provider's okay. Although exercise during pregnancy is generally good for both mother and baby, if the doctor might advise one not to exercise if they have certain forms of heart and lung disease, if they have cervical problems or vaginal bleeding, or any preterm labor or risk factors for preterm labor prior to or in a previous pregnancy. But we know that for most pregnant women, if you were active before pregnancy, you can usually continue a program of about at least 30 minutes of moderate exercise per day. Women who weren't active before pregnancy should slowly add low intensity, low impact activities. Because we know that sometimes intense exercise can limit the delivery of oxygen and nutrients to the fetus, so intense exercise should be limited. So here's some guidelines. This graph talks about some do's. The permission from your healthcare provider, increase activity gradually if you were inactive, exercise regularly, stop when you're fatigued, choose non-weight bearing activities, especially as your woman's pregnancy progresses, that don't require a lot of balance, such as swimming, and that reduces the risk of falls or abdominal injury, and making sure that women who are exercising drink plenty of fluids before, during, and after exercise. What we don't recommend is exercising very strenuously during the first trimester, exercising strenuously for more than 15 minutes at a time during the second and third trimesters, exercising to the point of exhaustion, or exercises that require lying on your back after the first trimester, scuba diving, or activities that entail risk of abdominal trauma, falls, or joint stress, and exercising in hot and humid environments. And many of those, as we said, were because intense exercise can limit the delivery of oxygen and nutrients to the fetus. So that's why they're typically not recommended for intense. Discomforts of pregnancy. You probably heard a lot about these. If not, we're definitely going to talk about them. The physiological changes that occur during pregnancy can cause some uncomfortable side effects. So some examples that we're going to talk about is, we know that the expansion in blood volume necessary to nourish the fetus often causes an accumulation of fluid or extracellular fluid in the tissues, and this condition is known as edema. And edema can be uncomfortable, but it does not increase medical risk unless it's accompanied by a rise in blood pressure. Many people have heard about morning sickness. Almost 70% of women experience nausea and vomiting during the first trimester of pregnancy, and this is commonly referred to as morning symptoms, but symptoms can occur at any time during the day or night. So not just the morning, and morning sickness is thought to be related to hormones that are released early in pregnancy, and the symptoms may usually be alleviated by eating small, frequent snacks of dry, starchy foods, such as plain crackers or bread, and in most women, the symptoms of morning sickness decrease significantly after the first trimester. But in some, they may last for the entire pregnancy, and in severe cases, women can end up dehydrated or with slow growth of the baby and may require hospitalization, IV fluids, or even total parenteral nutrition or enteral parenteral nutrition. Now it's kind of back and forth. A lot of times medications can be given to help reduce the nausea, antiemetics, and that sort of thing. Also, the hormones produced during pregnancy to relax uterine muscles also relax other muscles, so the muscles of the GI tract, and this relaxation, along with a crowding of the organs by the growing baby, can cause heartburn and constipation. Heartburn can be reduced by limiting high-fat foods, because we know those leave the stomach more slowly, avoiding some things like caffeine and chocolate that are known to cause heartburn, eating small frequent meals and remaining upright after eating can help reduce that heartburn. We know with constipation it can be prevented by maintaining a moderate level of physical activity and consuming plenty of liquids and some high fiber foods, just like in the non-pregnant person. As well, hemorrhoids are common during pregnancy because of the constipation and changes in blood flow to that area. So this is a diagram showing the crowding of the gastrointestinal tract during pregnancy. We see the uterus enlarges and pushes higher into the abdominal cavity, exerting pressure on the stomach and the intestines. So what are some complications of pregnancy? Almost 4 million women give birth every year in the U.S., have healthy pregnancies, but about 12% of babies are born too soon, and about 8% have low or very low birth weights, and about 6 out of every 1,000 of those born alive die in the first year of life. We know that in the United States, about 21 out of every 100,000 women die as a result of childbirth. And complications that occur during pregnancy, if they're caught early, they can usually be managed, resulting in the delivery of a healthy baby. So hypertensive disorders of pregnancy is fairly common, and about 5 to 10% of pregnant women in the U.S. experience high blood pressure during pregnancy. We call these hypertensive disorders of pregnancy, and that refers to a spectrum of conditions involving elevated blood pressure during pregnancy. And it can account for more than 12% of pregnancy-related maternal deaths in the United States. It's especially common in women under 18 and over 35 years of age, in low-income mothers, and those with a history of chronic hypertension or kidney disease. Gestation, there's a couple different types of hypertensive disorders that occur during pregnancies. The first we're going to talk about is gestational hypertension, and that's an abnormal rise in blood pressure that occurs after the 20th week of pregnancy, and usually resolves within 2 to 3 months after the birth of the child. And it can often signal potential for a more serious condition called preeclampsia. And preeclampsia is a condition that's characterized by high blood pressure, severe headaches, changes in vision, rapid waking, abdominal pain, and swelling of the hands and feet. And it's dangerous to the baby because blood flow to the placenta is reduced, and it's dangerous to the mother because it can produce a more severe condition called eclampsia. And eclampsia is a condition in which life-threatening seizures occur, and preeclampsia can often be managed with bed rest and careful medical monitoring, but if symptoms are severe, it may be necessary for early delivery of the baby. And this condition usually resolves after delivery. Preeclampsia and eclampsia are more common again in mothers under 18 and over 35, low-income mothers, obese mothers, and mothers with chronic hypertension or kidney disease. The cause, just one more thing on hypertension during pregnancy, is not fully understood. At one time, we prescribed, and I'm going to go back to that, low sodium diets to prevent preeclampsia, but studies have not found that these diets to be beneficial in lowering blood pressure or preventing this condition. And I do find that sometimes it's still prescribed to women. It's known that calcium may play a role in preventing hypertensive disorders of pregnancy, and women with high intakes of calcium have a lower incidence of these disorders, and calcium supplements have been found to reduce the risk of preeclampsia in high-risk women. Also, calcium supplements are not routinely recommended for healthy pregnant women. However, pregnant teens, individuals with inadequate calcium intake, and women who are known to be at risk of developing preeclampsia may benefit from additional dietary calcium. So again, that's dietary calcium, always good for hypertensive disorders. I wouldn't recommend supplementation, and that's done by a physician other than pregnancy multivitamin. Gestational diabetes is diabetes that develops during pregnancy and only in pregnant women. And this is a condition where we know that glucose passes freely across the placenta. So when the mother's blood glucose levels are high, the growing fetus receives extra glucose and hence extra calories. And that causes the baby to grow rapidly, and the baby's at risk for becoming large for gestational age, and consequently at an increased risk for a difficult delivery and abnormal blood glucose levels at birth. And we know that controlling the mother's blood glucose through changes in diet and increasing physical activity, and in some cases medication, reduces these risks to the baby. Gestational diabetes is common in obese women and those with a family history of type 2 diabetes, and we know that it occurs more frequently among Asian, African American, Hispanic, Latino, and Native American women than among Caucasian women. And it usually resolves after the birth of the baby, but up to about half of the women who've had gestational diabetes are at risk to develop type 2 diabetes within the next 5 to 10 years. And we know that babies born to mothers with gestational diabetes are at increased risk of developing diabetes as adults. We'll pause here till the next section.